Hello and welcome to Wellness and Autoimmune Center of Virginia in Virginia Beach. I am Chantal Owen, certified massage therapist, certified reflexologist, and Young Living Essential Oil distributor. Today I'm going to talk about a familiar yet adverse dilemma women too often have to face called PMS, and how to naturally decrease pain and improve quality of life during that time of the month through reflexology, essential oils, stress relief breathing technique, and other easy and effective tips. From Florida Hospital Medical Center in Orlando, PMS affects almost 85% of American women in the childbearing years, and 5% are disabled by PMS. Premenstrual syndrome refers to a group of symptoms women will exhibit at a different degrees of intensity prior to their cycle, which create hormonal changes, therefore altering brain chemistry because of neurotransmitter fluctuation of serotonin, GABA, and endorphins. Those physical, psychological, and behavioral challenges may sometimes be very overwhelming. Furthermore, it can strongly affect even strained relationships. It may greatly affect our work, our energy output, our temper, not to mention other additional factors such as stress, poor diet choices, and anxiety or depression that can potentially make it worse by creating what seems like an unbreakable cycle. Starting about a week or two prior to menstruation, the most common reported symptoms that can be improved naturally are abdominal cramps and low back pain, headaches, feeling tired, difficulty sleeping and poor concentration, bloating and fluid retention, food cravings, tender breasts, nausea, diarrhea, constipation, upset stomach, acne, crying spells, mood swings, irritability, aggressiveness, depression and anxiety, and so on and so forth. There is actually over 150 reported symptoms for PMS, but usually women will experience just a few of them, however invariably set to appear and disappear with her cycle. So in order to improve PMS, I personally use multiple tools and techniques targeted to benefit all aspects of the condition. Remember, we have to address the physical, psychological, and behavioral signs, which make things tricky, yet very personal, because there isn't one identical combo of symptoms, nor one fits all solution here. So instead, I offer what works for me, which is very adaptable and personable to my viewers' own needs. The easiest part, at least for me, is managing physical pain and symptoms. Usually abdominal cramps, low back pain, extreme fatigue, headaches, and bloating, however pretty intense, can be under control and short-lasting, about 1 to 2 days on average. Through reflexology, essential oils, the use of a hot bottle, and a good night's sleep. Reflexology can be applied on either hands or feet or both for optimum benefits. I personally prefer to work on my feet as they are more sensitive than my hands, so I have a stronger feeling of what is going on, therefore a greater response and relief. So first, I apply deep relief roll-on the spine reflex of my foot and thumb, walk the entire length up and down 3 times each way, with emphasis on the hypothalamus, the thyroid, and pituitary glands, because those glands are responsible for producing and inhibiting and releasing hormones. Then the sacrum and lumbar regions, as well as the uterus and ovaries reflexes. Often those reflexes are very tender, even painful, which require to adjust my pressure, but I make sure to work them out regardless. Then I move on to each toe and quickly press from the pad down to the base 1 to 2 times. Those, in my opinion, are always good to work on. Referring to the sinuses, the brain, and the 12 cranial nerves, The toes are a must-do and surprisingly extremely tender for most people. Then I stimulate the bladder, ureters, kidneys, and adrenal reflexes. And then I move on to the intestines and finishing with working the diaphragm and solar plexus. Then I repeat on the other foot. All those reflexes can also be found in the hands and are worked on in additional replacement of the feet. The second step, fast and effective, is topical application of essential oil to the site of pain. Few days, usually 2 to 3 days, prior to the beginning of my period, I will apply neat or undiluted, because I personally have no contraindications, essential oils of copaiba, clary sage, and peppermint, layered on my abdomen and lower back. Always apply peppermint last for greater benefits. It is recommended to skin test first if you have sensitive skin. And if you do, mix 3 to 5 drops of essential oils with a teaspoon of carrier oil of your choice. Can be coconut, jojoba, grapeseed, you pick your favorite. If you are unsure of potential interaction and precautions to take, please consult a professional. A third easy and effective tool to help abdominal cramp and low back pain is to help increase blood flow to the area by taking a hot bath with a couple of drops of your favorite essential oil, or use a hot bottle that can last for hours. Both methods would also help promote good night's sleep. Now, the most challenging part, however, for me, is addressing the psychological and behavioral issues. Compulsive irritability, unusual anger, and aggressiveness that doesn't fit my personality are usually the first signs of hormonal changes. Not to mention that being reasonable and rational for some reason can feel impossible during those times, for me, and maybe for you too. So to address that, I use essential oils via diffusion, inhalation, and topical application, which has been for me an unquestionable support. So I diffuse in my Young Living diffuser oil that I enjoy the most, with grounding, uplifting, and emotional balancing properties. I diffuse for 30 minutes to 2 to 3 times a day, 5 drops of my favorite blends that I alternate, being either Valor, Inner Child, or Peace and Calming. For example, my brain responds really well to Jasmine Absolute and Ylang Ylang, so usually blends with those will trigger a positive response. Many more blends are available and worth trying for emotional and hormonal balance that I would recommend to my clients once I determine their own symptoms and biggest challenges. When I can't diffuse or when I'm away from home, I use inhalation. It is a fast and easy way to calm down. I often smell the scent straight out of a bottle, or I place a couple of drops on a cotton ball or tissue paper that I keep with me in the car or in my desk or in my pocket for easy access wherever I go. You also can find on the market mini bottles holding just a few drops you can wear as a necklace. So in places with a scent-free policy, you still can benefit from essential oils without breaking the rules. On the contrary, when possible, I actually wear my favorite essential oils as perfume, just a drop on the side of my neck, on my wrists, or even sprayed on my clothes. Essential oil will be quickly absorbed and on average will reach each cell of our body in about 21 minutes. In addition to the protocol I just demonstrated, I practice a stress relief breathing technique that is the topic of another video that you may want to check out. Thank you for watching. If you want to learn more about how reflexology and essential oil can help you, and if you wish to download your PMS symptom tracker sheet to monitor your signs, it is easy as 1, 2, 3. 1. Visit my website at www.wac-ved.com to sign up and download the extended version of this video. Call to set up your complimentary consultation at 757-343-3902 or follow me on Facebook under Wellness and Autoimmune Center of Virginia.